NG insertion is another skill added to NMC OSCE skill station. These are the steps to be followed while doing this procedure. The time limit for demonstration of this skill is 12 minutes. As always, we will discuss this skill in 4 phases, which are introduction phase, procedural phase, and post-procedural phase. In introduction phase, you will have to check the area for safety and wash hands. Introduce giving your name and role. Confirm identity of patient and what they would like to be called. Check whether the patient has known allergies, including any dressing or adhesive. Explain the procedure and rationale, and gain full informed consent. Offer patient opportunity to ask questions and give clear answers. Provide privacy and dignity to patient as appropriate. Arrange signal with patient so that they can communicate if they wish to stop or hold, for example, raising hand or tapping arm gently. Cleans hands, assembles required equipment, cleaning if necessary, and checking items for integrity and expiry date. Return to the patient, don personal protective equipment. In the procedural phase, you will assess the patient to sit in a semi-upright position and use pillows to ensure there is no head tilt forwards or backwards. Using the nasogastric tube to measure, check the length of insertion from the patient's earlobe to the bridge of the nose, then from the earlobe to the bottom of the kiphisternum, and note the measurement on the tube. Check the nostrils of the patient by asking the patient to sniff with one nostril closed and repeat with the other nostril. Lubricate approximately 15 to 20 centimeters of the insertion end of the tube with lubricating gel or warm water, and ensure you have receiver placed beneath the end of tube. Insert the proximal end of the tube into the clearer nostril. Slide backwards and inwards along the floor of the nose through the nasopharynx. Stop if there is any obstruction, and try again, adjusting positioning slightly, or use the other nostril. If the patient is able, ask them to start swallowing as the tube passes down the nasopharynx into the esophagus. Advance the tube through the pharynx whilst the patient swallows until the measured indicator reaches the entrance of the nostril. Recognize any signs of distress, such as coughing or breathlessness, in which case remove the tube immediately. Use tape to secure the tube to the nostril and cheek. Aspirate a small, approximately 0.5 to 1 milliliter of the stomach content using a 50 milliliters enteral syringe, confirming the tube is correctly positioned by using a pH indicator strip to confirm the presence of acid. The pH should be less than 5.5. Uses Svigot or integral cap to cap the tube. In the post-procedural phase, disposes of equipments, including personal protective equipments, appropriately, and clean hands. Ensure the patient is comfortable post-procedure. State additional checks that may be undertaken to check tube position before commencing feeding, like X-ray. Further pH tests. Act professionally throughout in accordance with the NMC code. You can fail in this procedure if you do not recognize the significance of a displaced tube. That is, you are not able to state what pH should be to confirm tube positioning. Also, if you do not recognize the significance of additional checks prior to commencing feeding. We hope that this video helped you to understand the procedure of nasogastric tube insertion required for skill station in the NMC OSCE. If you want detailed article on this skill, please do visit our website, which is www.oscetrainer.com. Thanks for watching. Please share with your friends if you found this video useful to you.